Okay, hi everyone. Thanks for joining us today. We just wanted to welcome you to today's webinar, The State of the Data on Hispanic Children and Families. This webinar is part of our efforts at the National Research Center on Hispanic Children and Families to build capacity within the field to better serve Latino communities throughout the country. So I'll just start off by going over a few logistics. So throughout the presentation, all attendees will be muted, but if you have any technical questions, please submit them using the chat function on your side panel. So you should see a box on the right-hand side of your screen where you can easily submit questions to our team, and we'll get right back to you. And this is also the same place where you can submit questions to our panelists at any time during the presentation. We will queue the questions up and present them once the panel discussion is over. And we'll do our best to ask as many questions as possible in the time we have available today. And I just wanted to mention that today's webinar is also being recorded. After it ends, we'll upload the recording along with the slides to the Hispanic Center website, and we'll share that link with all registrants. And please feel free to share that link widely if you know of anyone who wasn't able to make it here today. So I'll just start off by covering some introductions. So I'm Michelle Buckland, Apps Project Director for the Hispanic Center, and I'll be starting off the webinar today. And then Allison Hyra will be facilitating the discussion later on. Allison and I are both from Apps Associates. I'm here in our Cambridge office, and Allison is in our Rockville office. And then joining us remotely, we have our three presenters. Wendy Manning is the Director of the Center for Family and Demographic Research and the Co-Director for the National Center for Family and Marriage Research at Bowling Green State University. Laura Spear is the Associate Director for Policy Reform and Advocacy at the Annie A. Casey Foundation and has primary responsibility for the National Kids Count Project. Dolores Acevedo Garcia is a Professor of Human Development and Social Policy and the Director of the Institute for Child, Youth, and Family Policy at the Heller School for Social Policy and Management at Brandeis University. So I'd like to start off with just a few words about the National Research Center on Hispanic Children and Families. The center was founded in 2013 through a grant from the Office of Planning, Research, and Evaluation within the Department of Health and Human Services. The center's mission is to conduct research and provide research-based information to help inform programs and policies supporting Hispanic families and children around three programmatic areas of interest: poverty and self-sufficiency, healthy marriage and responsible fatherhood, and early care and education. And because we aim to inform programs and policies, our research focuses on low-income Hispanics. And in addition to conducting research, we also fulfill our mission through building capacity activities, including building the pipeline of emerging scholars who focus their work in this area and providing tools and resources such as this webinar to the field. And through strategic dissemination and outreach, we make sure that the research gets into the hands of those who can use it. And to learn more about the center and our work, you can visit our website, shown here on your screen, HispanicResearchCenter.org. And you can also follow us at NRC Hispanic for discussion on today's topic and other issues important to low-income Hispanic children and families. And it's also important to mention that the center represents a partnership of research and academic organizations, including Child Trends and Apps Associates, 3 universities, NYU, University of Maryland, and UNC Greensboro, as well as our federal partner, OPRE. And a quick note that the views expressed at the webinar today represent those of the center and not the views of the federal government. So before we dive into our discussion, I just wanted to say a few words about why we focus on Latino children. So to do so, I'll just share 4 facts. The first fact is that today, roughly 1 in 4 of all children in the U.S. are Hispanic. The second is that economic security is precarious for many Hispanic children. Roughly 1/3 live in poverty. Third, the vast majority, over 90% of Hispanic children in this country are U.S. born. And fourth, although the vast majority of Latino children are U.S. born, the immigrant experience is a reality for many. As work that we released last year shows, 1 in 4 Latino children has a parent who lacks legal status. So as we think about our programs and policies and how best to support Latino families and children, it's important to think about their incredible diversity and experiences. So for today's webinar, I'll provide a brief overview Each of our panelists will then give a brief presentation on their unique perspective on the state of the data available for studying Hispanic children and families, and we'll follow this with a discussion and Q&A. And then just a reminder again to submit any questions you have into the chat box. Okay, so as many of us are aware, the U.S. population is becoming increasingly diverse, notably due to an increase in Hispanics. And whether we're researchers, scholars, practitioners, or policymakers, it's really important to have the right data and high-quality data to help us understand and meet the needs of our diversifying population, in particular Hispanic children and families. However, finding the right data is not always easy. So today, we'll talk about our current data infrastructure, how we might capitalize on the strengths of our current data, where the data could be improved, and what might be the goals of future data collection efforts to facilitate our understanding of our diversifying population. So to begin to assess the ability of our current data infrastructure to study Hispanic children and families, the Center has reviewed many commonly used data sets and produced a series of briefs assessing the data available on topics related to Hispanic diversity, Hispanic families and households, and early care and education. If you haven't already, you can view the briefs at the link shown on your screen. And we know that there are many data sets available which capture many different variables, and it can be difficult to even know where to start. So to help users identify which data sets best meet their needs and are best suited to answering their research questions, we have developed interactive tools based on the center briefs. And these tools also direct users to additional data documentation and information on how to access the relevant data sets. And you can find the tools at the link shown here. So here you can see a screenshot of part of one of our interactive tools. The rows cover several commonly used data sets, and the columns refer to different data elements. So in each cell, you can see how well each data element is covered in each data set. If you hover over a particular cell, you can see the information for that data set and that data element, including any additional information or notes. So in this example, you can see that the American Community Survey has data on marital history for the respondent adult. And you can also click on this cell to be directed to the website for that data set. And then over on the left, the drop-down boxes allow you to filter by the data elements you're most interested in. So for example, you can choose to only view data sets that have extensive information on marital history. So based on our briefs and interactive tools, I'll just share a few very high-level findings, but we encourage you to read the briefs and check out the interactive tools if you haven't already. So as we talked about, the Hispanic population is very diverse, and it's important to understand and to be able to compare and contrast groups within the Hispanic population. So to help understand this diverse population, ACF's Hispanic Research Work Group recommended 10 data elements for studying Hispanic populations. And we found that fortunately, many national data sets include at least some of these 10 data elements. However, only one, the National Agricultural Workers Survey, included all 10 data elements. Unfortunately, we also found that no survey allows us to get a complete picture of Hispanic family life. Data are available to describe the structure of Hispanic families and households, but there is very limited information on Hispanic family life, coupled relationship dynamics, and parenting. And we found that elements of early care and education, or ECE, search and decision making, and ECE utilization are included in large-scale publicly available data sets, but there's wide variation in the comprehensiveness of the data. For example, the NSECE captured the ECE search process more fully than did other data sources. And there's variability in utilization information. So for example, whether the focus is on the primary care arrangement versus multiple care arrangements, or whether it's for one focal child or multiple children. ECE attendance is largely unmeasured across data sources, and there's little information available on ECE trajectories of Hispanic children over time. And the availability of data elements related to parents and children's experiences with ECE, so their satisfaction, the quality, and whether the ECE is meeting families' needs is much more limited. Okay. Okay, so again, very high-level findings, and we encourage you to check out our briefs if you haven't already. And with that, I'll turn it over to Wendy to share her perspective on the data infrastructure for studying Hispanic children and families.
They're very near and dear to my heart. So to start, can you click the next slide? Hello? Oh, so the Hispanic population has been growing. We've hit a new high point. This is well known. That's part of the reason why you're on the call today. And so this is not news to anyone here. Hispanics represent around 17% of the U.S. population. Next slide, please. This is associated, I'm just trying to show you what you've already heard, that there's great diversity. This is a great slide from the Pew, where they actually break down different ethnic groups, and where a lot of the growth we're seeing is among Central Americans, but this just shows you the pure numbers belonging to different groups, and this is pretty strong implications for understanding of the well-being of children and families. The next slide is something that's quite relevant to some of our debates about families and the implications for them are what share of foreign-born, and as you can see here, this is again from Pew, that the share of foreign-born are declining, and most of the growth that we're seeing, or a larger share of the growth in the Hispanic population today, is due to fertility and not really migration. Next slide, please. And this is something with a very nice graphic that we already heard, that 1 in 4 children are Hispanic, and that we expect by 2050 about 1 in 3. So this remains a very important question in a growing an increasingly diverse population. So if we turn to the research on child well-being, we've seen many calls for increasing attention to Hispanic children, trying to consider their unique experiences, and focus on variation that we observe among Hispanic children. And so this has well been articulated by many leading researchers who are at Child Trends and the Hispanic Child and the National Research Center for Hispanic Children and Families. So I'm not going to detail all that here. I'd really like to focus on the next slide, which is focusing about some that highlights there's a large body of research about some of the paradox in child well-being, and so there's some interesting papers that are focusing on distinguishing foreign children who are born to foreign-born parents and those who are born to native-born parents. And we might expect that children born to foreign-born parents might fare worse because they experience higher levels of poverty and have lower levels of education. But despite that, some of those differences and lower levels of participation in government programs, we see that actually native-born Hispanic children are faring worse on some of these very critical indicators, the adverse childhood experiences. That's what ACE stands for. And so there's a number of studies and other work that sort of confirms this paradox. And so it's sort of this idea of, despite the lower levels of economic well-being, lower parental resources, why are we seeing children born to native-born parents faring better? And so this body of research really calls for new data and to help understand the well-being of children and families. And so if we go to the next slide. I outlined some data needs. Some of these are articulated well in many of the documents that have been shared with you today. I will focus on families and households, which is my expertise, but I'll just repeat the importance that nativity status is not sufficient, but as you can see, some of these data do not allow us to include country of origin. That's been excluded actually from some critical national surveys. As the socioeconomic characteristics of those countries, the sending countries in terms of the education and characteristics of the immigrants are going to have implications for child well-being. Of course, the conditions of migration are going to matter. So if we're considering families that are coming through legal channels as refugees or as undocumented, are going to have implications for child well-being. It's not just simply being foreign-born or native-born. The amount of time that parents have spent in the U.S., so if parents have been in the U.S. for a relatively short time, we might expect different implications for children well-being than if they've been in the U.S. for 15 years, for example. So, and then the idea of citizenship is sort of tricky when we think about families. We have mixed status families where the children are citizens but the parents are not. And this has received growing attention when we're trying to understand child well-being, because having citizen, and then also families where some children are citizens and some are not. So this complexity can lead to different implications for parents and children, but sometimes we're not, it's not easy to capture these kinds of families, but we expect there might have different implications. The next slide is the contemporary climate. It's difficult to capture that. We need new data. Longitudinal data are wonderful because we can capture some of the, maybe capture some of the causal pathways through which children do better, fare worse or better, but they have to be, but they're representative at the time that the initial data were collected. So for example, maybe the PSID would be an example where it's representative of the population in 1968, but probably not representative of the population today, and that might have implications, especially when we're talking about new immigrant groups and more diverging groups of immigrants in the U.S. and differential growth in the population. So, and also many studies don't have a large enough immigrant samples to pursue very refined analyses. Then the next slide, there's a call for more work that's going to broaden the kinds of well-being measures. So sometimes we get, for comparative purposes, we have specific measures we want to use, but they might not capture the immigrant experiences. So some of the stress and strain that's associated with migration is not, those indicators might not be asked. We have separation of parents is often part of the migration process, as parents might even return to their home countries. And so what does that mean, and what kind of separation, how does that differ from other sorts of parental separation that we observe, maybe through, there's been a lot of research on parental incarceration, for example, or family instability, but not separation due to migration. And then just as we said, the stress, especially maybe in the current climate of migration and immigrant life in the U.S. and what it means and how you might raise your children in, and those indicators specifically of stress related to belonging to a minority group, but a specific minority group such as Hispanics has not been well articulated in many studies. The next slide. Also, as I said, we have some low levels of program participation among especially foreign-born Hispanics, and so why aren't they tapping into some of the resources that are available and trying to determine that? Because they have relatively high need, and some of the research on this is focused on linguistic barriers and literacy issues, and those are not as easy to measure as you might think, and so just trying to figure out what are some of the factors that might increase participation in programs would be a important venue for new data collection. Next slide. So now just to quickly to focus on families and households. Sometimes we measure families and households as if they're static and fixed at one point in time, but especially among groups who have high levels of migration, we might see a lot of movement in and out of homes of family members or other relatives or just other individuals as people are providing support and assistance to one another. As we could have marital separation, as I mentioned, that's due to migration or employment. That's not marital separation due to discord of the relationship. And we need to think about new ways we could capture that. We have extended family households, so sometimes we just focus on sort of a nuclear family perspective, but we have other family members who are present in the household. who might be providing resources or might be having high levels of expectations for resources. About 1/3, some recent research shows that about 1/3 of Hispanic children are expected to spend some time in extended parent-family. A topic that I've focused a lot on is this unmarried partner status or cohabitation. And so there's a number of data sets that measure this in terms of a marriage-like relationship, but in fact, people might not classify their cohabiting partner that way. And this is especially important when we're studying Hispanics. About 60% of Hispanic women have spent some time in a cohabiting parent-family. Most of the increase we see in non-marital childbearing for Hispanics is due to fertility within cohabiting families. Those are actually two parent families. And so we've seen, but they're not benefiting from some of the marital resources. And we know that cohabitation is higher among native-born Hispanics than it is foreign-born. And so thinking about how to measure this and how this term might translate to Spanish would be important in new data collections. And then we also want to know how marital and family experiences influence child well-being, but we lack information about cohabitation histories and data sets like the SIP, the ACS, and the current population survey. And so we don't always have data to track children's experiences in these different kinds of families. And the next slide is focusing on trying to establish who are the parents of children. So we like to focus a lot of our data collections on the dates when relationships start rather than the biological relationships of children to different individuals. And if we would refocus our attention that way, we might be better able to capture family experiences and determine who is the father. And so we sometimes presume somebody's the father if somebody married while they're pregnant, but that's not always the case. And some folks decide to marry maybe a year or two after a child is born, but it's very challenging to determine if they're marrying the father of the child or another unrelated male and forming a step family. We know very little about the quality of relationships as well as parenting indicators in a lot of surveys, and these are going to be important if we're interested in understanding child well-being. Certainly the quality of the biological parents, of the relationship of the biological parents as well as the resident parents matters. And there's been a new call for work about Latino fathers and how they're parenting their children and how working families are negotiating parenting and work-family stress. So to sort of wrap up and allow time for questions, my next slide just references the resources. I want to mention the National Center for Family and Demographic Research. If you're ever, this is actually National Center for Family and Marriage Research. If you want to flip to the next slide, I just wanted to show everybody we have this nice web page, and if you just go to resources by topic, and if you clicked on that, and if you go to the next slide, you can see all the different topics we have, and often we will have statistics that are separated by race and ethnicity, and at times, if available, we will by nativity status, and sometimes these might present some interesting findings and also some good groundwork for further research, or also some guides to some data sets that might be helpful for your work. So I think using this in combination with some of the tools that we showed you earlier might be helpful. And I think that's my last slide. Is that correct? And I will turn this over to Laura. So thank you.
Okay. Hopefully you all can hear me. Hi, everyone. My name is Laura Spear. I'm at the Annie Casey Foundation, and I'm going to focus my remarks really on the issues that we found really around using data for advocacy and to advocate for issues of equity, specifically focused on Hispanic children and families. So you can go ahead to the next slide. For folks who don't know the Annie Casey Foundation, we are the largest private foundation in the U.S. that's specifically focused on disadvantaged kids. We do our work mainly through really looking to impact systems and structures that are either helping children and families be successful or serving as barriers to their success. And the next slide shows you some of the work that we've done on the Kids Count Project. Hopefully some of you have heard of the Kids Count Project. We've been doing it for a really long time, since 1990. We started with just doing the Kids Count data book, and in fact, next year will be our 30th Kids Count data book release. We have done this from the very beginning as an effort to lift up, to track child and family well-being, to lift up kids on the public agenda, and all in an effort to try to change outcomes for children. We do have the data book still, and we also do a series of policy reports, one of which I'm going to get into a little more detail on, which is called Racial Results. And we have our Kids Count Data Center, which the website's there on the bottom. Hopefully you all have visited the data center, or you will visit it. Really, that's the place where we have the most in-depth data available for lots of different levels of geography. And many of the issues that I'm going to talk about are mostly about getting data at lower levels of geography, especially for Latino kids. Go ahead to the next slide. Another big part of the Kids Count project is our state network. We work with groups doing Kids Count in all 50 states, D.C., Puerto Rico, and the U.S. Virgin Islands. They're tracking child and family well-being measures. They use data, both federal statistical data. The ACS is a big source of data for everyone, including these folks. They also really rely on data that comes from administrative data sets from state and local schools, child welfare agencies, juvenile justice systems. So the remarks and what I'm going to talk about has a lot to do with not only the data that we were able to get from the federal statistical systems, but what's available and what's not available at the state and local level from these state agencies. So you can go ahead to the next slide. I'm going to talk a little bit about this report that we released. We released the first report in 2014, and we did a recent update in 2017, a report that was called Racial Results. The Foundation did the report really as an effort to lift up the issues of equity that still exist for kids of color in the United States. We decided to develop a set of measures. They're listed here. We did this with the Population Reference Bureau and Child Trends. They're really our key partners in all of our data work at the KP Foundation, but we also get the input from a range of stakeholders. These metrics are loosely based on the metrics that are outlined in the Social Genome Project around, what are the things that most closely align with being middle class by middle age. And we took these measures, we gathered the data. Most of the data came from the American Community Survey, but we also used data from Vital Records and from the National Center for Education Statistics and NAEP data, and attempted to create an index using these measures around kind of how kids are doing by state for the 5 largest racial groups, including Latinos. The next slide is our recommendations for Racial Results. I included them here mainly because we start out in the very beginning around this issue around gathering and analyzing data. These recommendations are really the things that we thought are most important in order to embed equity in policy making and decision making. And we believe that that really has to start with gathering and analyzing data, and especially for kids of color and groups that are generally struggling on lots of the measures that we're tracking at the local level. The data has to be gathered and analyzed in the most in the most detail possible, which is part of the issue certainly with Latino families, but really all many groups, especially foreign-born or kids in immigrant families in all racial groups. having access to data that allows you to be able to look at whether or not the families are foreign-born and what countries they're from. Many of the items that have already been discussed around marriage and the family situation for the kids, but also the immigration status or the, whether or not the immigration status of the family. We know all of these things have major impacts on children, so we believe that being able to analyze data and gather information on outcomes at a very detailed level of data gathering is really critical if we're actually going to make change for these kids. So you can go ahead to the next slide. I wanted to start out, and I have a couple of slides around kind of what are the most critical issues we think around monitoring equity. And I wanted to start out with the progress, because I do believe that we actually have made a lot of progress on this from where we were, even 10 years ago, certainly before the American Community Survey came into the picture. But and part of that has to do with the fact that I believe that the understanding of the importance of equity and why we need to track this has improved data access. There's lots of great resources, including one that I know we're going to hear about when I turn it over to Dolores, the Diversity Data Kids portal. There's lots more available now than there was before. There's an increased evidence on evidence building and policy making that is continuing even in the current administration, as far as we can tell, and that's certainly a good thing. There's still room for improvement on that front for certain, and there's actually something I'm going to say and then in the next slide about that. Clearly, growth in the Latino population has forced the conversation to move beyond just tracking whether or not there's children of color versus white kids, even in places where this was not part of the conversation 10 years ago, and that's certainly the case when we talk with folks working and across the country in rural areas in the Midwest, where they're now realizing that their data systems are not adequate if they want to be able to see what's going on for Latino kids and other kids. And of course, the National Research Center, folks like Aspen Child Trends, have made a big difference in elevating this issue, and that's certainly progress. So next slide. So now on to the challenges. I think that the resources that the National Research Center has pulled together has lifted up many of these issues already, certainly on the lack of consistency monitoring across federal data sets, and for folks like us who are looking at lots of different areas of well-being and of family and community well-being, which we really need to be able to look at things often across data sets, and that's always a challenge. It's even worse at the state and local administrative data level. It varies very widely across states. Not only what they're tracking, but what advocates can get access to differs a lot, and that has implications when you're trying to look at issues of equity for Latino kids, or being able to even see kind of program participation, all the things that have been discussed. On the side of more evidence-based in policymaking, we have made progress, but there's still a lot of room for improvement in terms of actually being able to understand whether or not the solutions that are evidence-based will work for Latino families, as well as other groups of kids. And that's an area where there has been some work that's been done on that side, but there's more that we need to do. The current data collection is not evolving fast enough to track our concepts of race. And the specific example that came to my mind right away was what happened with the work that had been done at the Census Bureau for the 2020 census in order to make changes to the race and Hispanic origin question, to have it track with what we, the way that we think about ourselves, the way we describe ourselves, and that effort has been halted in terms of being included in the 2020 census, and that's a problem. And then finally, and this is probably should have been the first one on the list, but the current political situation, the current situation at the federal level has certainly increased the level of fear in the Latino community and mistrust in government, and fear that that information that's being collected in surveys will be used in ways that's not being identified by the person who's calling them and asking them for the data. This is a major problem. It's a major, and I'm sure that folks who are on this call who do survey work know that this exists, especially in immigrant communities across the country. So, next slide. So I've included some possible solutions. Michelle asked me to see if to do that, which is always a good thing to do if you're going to identify issues. The first is that I think that the work that the Research Center has done focused on the federal statistical system is great. It would be really great to also do it at least at the state level, if not at the local level, to try to give to do more analysis around what's happening with state administrative and local administrative data sets, and give some guidance on, if there's an opportunity to add questions, if there's an opportunity to collect additional data as it relates to Latino families, that all the things that you're learning at the federal level could be shared at that level. Also, supporting efforts to protect and increase the confidence of protect data and increase the confidence of Latino families. I know that the National Immigration Law Center has prepared some recommendations for state governments and local governments to use in order to both basically assure their folks that their data is safe, and some extra protections that you can put into place if you're a state or local government. But I think this is an important step, even if it's just a matter of putting that information on a website somewhere, making sure that folks know that folks at the agency that folks in the agency are thinking about it, and continuing the work that around revising the race and Hispanic origin questions, even if it can't be done in the 2020 census. I think there's opportunities to do it in other places at state and local level. And then finally, I don't want to, and I'm about to close, but I know I've gone over, talk about the 2020 census, at least to say that folks, even if you're not working at the Census Bureau, this is really critically important if you have connections to the Latino community in both promoting the fact that it's important and why it's important that everyone fill out their census form. We know that young children are the group that's the most likely to be missed in the census. And so, and if folks are interested in learning more about this, I'm happy to make the connections with some of the work that we've been doing at the Casey Foundation to try to create a hub to promote a complete count of young children in the census. So I think that's it. I think I'm on the last slide. We can go to the next one. This is just a promotion to go to the website and check out the Race to Results report. We have some case studies that there's actually one that specifically is around data. So I suggest folks take a look at that. Okay, that's definitely my last one. We go now, I think, to Dolores.
Thank you, Laura. Michelle, if you can please show my outline. Next slide. Okay, we heard from Michelle that the center has put together some great interactive tools to summarize what we can learn from various data sets about Hispanic families. My role today is to provide a rationale for focusing on Hispanics and unpacking their diversity. I'm going to do this by presenting a compelling example about infant health to show not only Hispanics are distinct from other groups, but also the variation within the Hispanic population. So why Hispanic families and children? First, the demographic significance of Hispanics is the main reason for focusing on this population, but it's also important that the Hispanic population is changing. For example, second-generation Hispanics are becoming a larger part of this population. Also, Hispanics show unique patterns of resilience, as I will be showing with the example of infant health, but also face risks that are specific to this population. And finally, many of the programs we currently have to serve low-income families were designed several decades ago when Hispanics were a much smaller group. In the last couple of decades, we have seen many changes. On one hand, some programs have changed to better serve the Hispanic population. For example, the increased attention to dual language learners in Head Start. But on the other hand, starting in 1996, we have seen increased restrictions on eligibility based on immigrant status, even for immigrants authorized to be in the U.S. Next slide, please. An important dimension of the Hispanic population is its composition by generation in the U.S. We will see later that mother's generation in the U.S. is clearly associated with infant health outcomes. In 1980, Hispanic children were predominantly third generation or higher. This is the blue portion in this bar chart. That is, they were the children of U.S.-born Hispanic parents. Today, the majority of Hispanic children are second generation. That is the red portion in this bar chart. That is, they are the children of immigrant parents. The generational composition of Hispanics continues to evolve. Starting in the 2000s, births replaced immigration as the main source of growth of the Hispanic population. What this means is that in the future, third-generation Hispanic children will represent a larger share of the Hispanic child population. Therefore, our data collection system should be equipped to tell us who the Hispanic population is today and in the future, including the implications of important changes in its composition, such as generation in the U.S. Hispanics show distinct patterns in child outcomes. As an example, we will talk about infant health. We don't have time today to discuss unique patterns in child contexts, such as neighborhoods and schools, or differential access to policies and programs, but I invite you to check out our project diversitydatakids.org, which has a lot of data on these issues. Next slide, please. The interactive tool by the Hispanic Center allows us to tell whether a particular data set has information on the variables on this slide. I will examine two of the factors covering the Hispanic Center tool, generation in the U.S. and national origin. And I will also show socioeconomic status and geography because there are important interactions between Hispanic diversity and these factors. Next slide, please. Wendy talked about the pattern of the Hispanic paradox in general in relation to child well-being. I'm going to talk about it in relation to health. Hispanic adults and children have better health outcomes than we would predict based on their socioeconomic status. This phenomenon is sometimes called the Hispanic health paradox. Although researchers don't know yet specific sources of this health paradox, overall, the favorable health outcomes that we often see for Latinos are a function of the large proportion of immigrants among this group, and the fact that immigrants tend to have a better health profile. This phenomenon is referred to as the immigrant health advantage. However, as we saw earlier, the second generation is not contributing most of the growth of the Hispanic population. In a few years, the second generation Latino population will be larger than the first generation. So we have to be concerned about the possible erosion of health status that we may see from these changes in composition by generation. Next slide, please. So I'm going to talk about low birth weight, a very important infant health outcome. Low birth weight means that an infant is born with a weight of less than 2.5 kilograms. It is a risk factor for infant mortality, health and developmental problems during childhood, and even health problems in adulthood. Some patterns that I want you to note on this graph. First, low birth weight rates are much higher for Black babies, and that is a serious public health problem that we as a nation have not been able to solve. Low birth weight rates for Hispanic babies are roughly comparable to those of white babies, which has puzzled health researchers because on average, Hispanic mothers have lower income, less education, and less access to health care than white mothers. Next slide, please. That's fine, thank you. Let's try to disaggregate by looking at the babies of U.S.-born women and the babies of immigrant women. In all racial groups, low birth weight rates are lower among babies of immigrant mothers than among babies of U.S.-born mothers. This protective effect of immigrant status is a pattern that we observe for many health outcomes. So it's very important that we disaggregate data by immigrant status of the mother because second-generation babies show a health advantage. That is true in other groups, but it's especially important for Hispanics because more than half of Hispanic children have immigrant mothers. Another important pattern is that while among white and black babies we see a strong maternal education gradient, that is, babies of mothers with higher education have better outcomes than mothers with lower education, among Hispanics we see a flat pattern. That is that we see a distinct pattern of resilience among Hispanics, even among babies of mothers with low education. These babies are more likely to have a healthy birth weight than babies of white or black women with low education. This is an important pattern from a population health perspective because a large proportion of Hispanic mothers are women with a low education level. If we continue to disaggregate, we see that this issue of resilience or good birth outcomes despite low maternal education among Hispanic mothers is a pattern driven by immigrant mothers. If we disaggregate further by national origin, next slide please. Next slide please. If we disaggregate further by national origin, we see that the immigrant advantage and the resilience of babies of mothers with low education is particularly clear among babies of Mexican origin mothers. Next slide. There is also a lot of geographic variation. I'm showing here DC, Florida, and California, and there is also significant variation at lower geographic levels. The main point I want to make here is that the majority of our surveys are nationally representative surveys, so even when they include some important variables such as foreign-born status or language, we are not able to examine geographic variation, which is key for surveillance and for targeting services. Next slide, please. The natality data are a good model of a complete census that has information such as generation and national origin. And importantly, they allow us to do geographic disaggregation down to the county level. The second layer of this data system is PRAMS, the Pregnancy Risk Assessment and Monitoring System, which allows more detailed collection from a sample of births in the natality data. The PRAMS survey includes some questions relevant to the Hispanic population. For example, whether the mother has not received government assistance programs because of her citizenship status. So combined, the natality data and PRAMS are a good example of how we can augment data collection to learn more about Hispanics. Next slide, please. There is also room for improvement in data collection. First, we need to consistently collect variables such as maternal education because the patterns for Hispanics look different than for other groups. There is also room for linking the birth data to administrative data systems to track child outcomes and target services. For example, early intervention for very low birth weight or premature babies. PRAMS could also include a supplement specifically developed to examine issues facing the Hispanic population or immigrants. And PRAMS already includes information on programs to support healthy child development, such as home visiting, but we could add more questions about delivery of programs, for example, language access. Currently, PRAMS sample sizes range from about 1,000 to 3,500 women. Some states oversample Hispanics already, but Hispanic data disaggregation likely requires larger sample sizes. Next slide, please. So just a few thoughts to conclude. Why does data disaggregation matter? I hope that together this panel has shown you that this is not only an academic question. We are talking about nearly 1/4 of U.S. children. And also, this is a population that is changing. Immigration is down. The national origin of immigrants is changing. Fertility is lower, including fertility among immigrants. So we need to proactively try to understand how these changes will affect child and family outcomes. And we also need to make sure that there is a formal feedback loop between data, research, and programs, which Laura talked about. And finally, although data disaggregation is a powerful tool for research and programs, it's not possible to ignore that we are living during a time of heightened sensitivity around data collection on citizenship status and immigrant status in general, as well as a climate of increased restrictions on immigrant eligibility and access, both of which, of course, negatively affect our ability to collect data, but much more importantly, they affect the well-being of Hispanic children and families. So with that, I'm going to turn it over to the audience to ask some questions. Thank you.
Great. Thank you, Dolores. I'm cognizant that we only have a couple minutes of time for questions, and we got a ton of questions in. So, folks, if your question does not get asked, it's not because it wasn't excellent. It's because we don't have a great amount of time. So my first question is to all three presenters. What would be your highest priority for future data collection to help us better understand Hispanic children and families? Would it be the inclusion of a specific measure to an ongoing data collection effort? Would it be the funding and development of a brand new data collection effort, a combination of the two, changes to administrative data, etc.? I'm going to go ahead and start in the order of people that presented, so I will ask you, Wendy, to respond first.
I will take the safe answer and probably say a combination is best. I mean, I think there are ongoing data collections that could benefit from additional questions, but I think a new questionnaire that's dedicated specifically to the experiences of Latinos in the U.S. could and all ethnic groups would be very fruitful.
Laura?
Well, I'm going to go with the administrative data side of things and really make a pitch for doing some, bringing some of the things that you all have learned and are exploring with the federal surveys to the state administrative data sets, because it has the potential to impact many millions of children, many millions of children who are at heightened risk levels, and it's really the place where we're able to get data for small populations. So that's my vote.
Great. Dolores?
I think I would also do a combination. I think that we can augment surveys that are very, very strong, like the CPS, the Current Population Survey, which actually has a lot of really good information on immigrant status in general that is very relevant for Hispanics. And it has a lot of supplements. And just to give an example, many years ago I worked a lot with the tobacco use supplement. And it's great because you can ask a lot of questions about smoking behavior, and it's a very unique supplement that was produced by the National Cancer Institute. And then you can link it to all the incredible demographic and socioeconomic variables that are already in the CPS. So I think starting with strong surveys and doing a supplement is one way to go. And the natality data is a similar example, starting with the census of the population, in this case births, and then making PRAM stronger to collect more and more information about not only Hispanics but other immigrant groups and issues of access that affect many different populations.
Great. Okay, this next question is for Wendy, but then I'll ask other folks if they'd like to add anything to it. We've talked a lot about capturing important elements of Latino diversity in terms of demographics, but even if you have a robust sample that collects a wide amount of information about Latino diversity, it's often not clear that some of the dependent measures are culturally relevant. How would you recommend that researchers go about determining whether a measure is likely to be valid and reliable with Latino populations, given that many measures and scales were not developed with those populations specifically in mind?
I mean, I think that's an excellent question, and one approach would be to do more cognitive testing and more development work prior to including questions on surveys. So there's also some excellent research that's not based on population-based samples, but very specific samples of certain subgroups that might actually be very relevant for developing new measures. So I think thinking across sort of a mixed method approach and drawing on some research that might already be there, but we might dismiss because it's based on a relatively small sample in one community, and seeing how it would work in another community would be helpful.
Dolores or Laura, do you want to expand?
I think the issue of validity is really important, and sometimes we take for granted that some strong validated measures such as cell-rated health are valid across a variety of populations, and that is actually sometimes not true, not only specifically for Hispanics, but other groups, and also regarding immigrants versus non-immigrants. So I think that a lot of research is needed to validate measures across diverse populations. And I think another question that is really basic, which I think Laura alluded to, is what is the meaning of the race and ethnicity questions for Hispanics and other groups? And we ask these questions routinely on a lot of different data tools that we have. And actually the race question tends to puzzle Hispanics, especially immigrants and newly arrived immigrants, because we don't have the same understanding of race as the one that is prevalent in the U.S. So I think that from a researcher point of view, it would be fascinating to see whether these measures, both race measures and outcome measures, are valid specifically for Hispanics.
That's a great point. Laura?
I got nothing to add. Those are probably all.
I'm going to follow up on that point that Dolores just made, and then I'll do one closing question. So, Dolores, you're right. Like, most Latinos do not think of race and ethnicity being separate categories like researchers tend to define it. How do you recommend that folks speak the researcher language to lay populations and help people understand what it means when a researcher says a non-Latino white population looks like this versus a Latino or Hispanic identified population looks like this? How do you translate the way researchers define race and ethnicity to the way lay people, particularly Latinos, identify in those sort of spheres?
I think that for the most part, I, as a researcher, feel comfortable presenting the data for Latinos. I think that we have a general common understanding of what the population is, and I think most people, including lay people, understand the issues of diversity within the Latino population, but I don't think it's a barrier for communicating larger issues of access or discrimination that affect Latinos across the board. I think that although the questioning is complicated in the sense that we ask race, ethnicity separately and then combine them, most Latinos, I think, if they see the options of different national origins or sub-ethnicities, would feel comfortable identifying as one of those. And I think it's also a very important part of the race picture to know that a lot of Latinos identify as white or other because especially newly arrived immigrants are not familiar with the racial categories in the U.S. And actually have never thought about race in those terms. So I think it's important to distinguish what we would like to do as researchers to create a really sophisticated research agenda about issues of identity and what we need to do in terms of improving access to programs. I think that the latter probably requires less work in terms of identifying race and ethnic identity issues.
Great. Thank you. Okay. Closing with one final question that's open to all folks. Again, we'll go in order of presenters. Adding data elements to ongoing efforts or designing and conducting new data collection efforts are expensive. What do you think members of the research community should say to potential funders to convince them of the utility and need for more data collection expansion efforts?
That's very well-phrased comment, and I think I wish I knew the answer to that, so I'll probably just be 100% honest. I don't know what will work with funders. I think we need to create interdisciplinary teams and have large groups go in so the voices are heard. And I think many comments made today provide some good basics for that. But I think the paradoxes are very interesting when you're trying to suggest new data collection. So we have a problem we need to solve. And I think if you can frame it that way, you might be more successful than just saying we need more data, because everybody thinks they need more data for different groups. So I think solving specific paradoxes is going to capture the imagination of maybe reviewers and funders.
Laura?
Okay, well, as a funder who loves data, I mean, the Casey Foundation and the work on Kids Count, we probably are the outlier on that front. But I think, I will say that even at Casey, we have, we don't have the luxury to fund as much sort of straight research as we used to. And, what's happening in terms of the we just, the priorities have shifted, and so it's really critical that the requests are framed around issues, around solving problems, as Wendy just said, and the fact that using that data will help to be more efficient with the vast amount of money that the government is already spending on programs for kids and families. I think that there's opportunity to make that case. But, the reality is that the funding world, both, I think, even in the public sector, but certainly in the private sector, there's just, I think, less of an appetite to fund sort of just straight research. So making the connections to why, what's going to be kind of the bottom line impacts are more important than ever.
Great. And Dolores?
I agree with the previous comments. I think it's very important to tie data collection to solutions to better programs, better policies. And I think that it is understandable that in today's climate, funders, a lot of the funders, maybe philanthropy, are going to be compelled to do something that is more action-oriented, because in their minds, maybe data collection is not so action-oriented, because there are a lot of eligibility and access issues that we are facing today that are extremely serious. And so I think that access to programs, clear connection between data collection and improving programs is very needed for everyone, including researchers, to be effective. And then the other piece I think that we talk a lot about is the issue of equity. Latinos are a very significant portion of the child population, and some of the patterns of inequity that we observe in terms of opportunities and outcomes are very stark, similar to the ones that we observe between African American children and other children. So I think that in my mind, a lot of funders, again, philanthropy primarily maybe, are going to particularly resonate with the issue of equity in addition to policy solutions.
Great. Thank you so much. So I think with that, we're going to go ahead and start closing down. So I wanted to close with a round of thanks. Thanks to all of the staff of the Hispanic Research Center that helps get this organized and produce the webinars. Thank you to the Hispanic Research Center's funders, to our panelists, Dr. Wendy Manning, Dr. Dolores Acevedo Garcia, and Lauren Spear, and most importantly to everyone who logged on today to connect with us. Have a great rest of the day. As Michelle mentioned earlier, the slides and recording of today's webinar will be available on the Hispanic Center website. And as you see on your screen right now, we've got some emails up. I know we weren't able to get to everybody's questions. If you want to reach out to us, you can do it through those emails. And thank you and goodbye.
Thank you.
Thank you.